Welcome to America's Talking, powered by the Center Square. I'm Dan McCaleb, executive editor of the Center Square Newswire service. With Obamacare Premium Tax Credits that were enhanced during the COVID-19 pandemic set to expire at the end of the year, Republicans in the House passed an alternative replacement this week on a party line vote. The Lower Health Care Premiums for All Americans Act is likely doomed in the Senate, where Republicans hold a slim majority but need a handful of Democrats to jump on board to get to the 60-vote threshold. Joining me today to discuss this is Therese Boudreau, congressional reporter for the Center Square. Therese, tell us about the measure and its prospects in the Senate.
Yeah, so this is kind of a last-minute measure from Republicans, the Lower Health Care Premiums for All Americans Act. And so it's not very all-encompassing, to be honest. There's like about 5 key reforms that we've reported on at the Center Square. One of the big ones is that it finally opens up funding for cost-sharing reductions, which it's the CSR is part of was originally part of the Obamacare original Affordable Care Act, but a judge ruled that there weren't official appropriations for it, so the money couldn't actually go out and lower people's premiums. So it would under this. But essentially, it was kind of just a bunch of ideas that Republicans threw together and put into a bill and said, hey, let's do this instead of extending the enhanced Obamacare Premium Tax Credits. And so no Democrats voted for it, and it's going to most likely fail in the Senate because, as you said, there's the 60-vote threshold that they need to break, and there's no way they're going to do that because they have only 53 Republicans there. But so this has been going on for quite a while, as I'm sure many people know if they've been keeping up with the news at all, because the enhanced Obamacare Premium Tax Credits are the entire reason why Democrats say, at least, that they shut down the government months ago. That 43-day-long government shutdown, the record, was because these credits were expiring at the end of the year. So basically, the Obamacare Premium Tax Credit is a subsidy that goes to insurance companies. And it was part of the, original ACA. And then during COVID-19, Democrats in Congress enhanced it, extended it, expanded it to, so now there are some people with these tax credits who are on $0 premium plans. There are people who are making 400 times the federal poverty line who are receiving it, things like that. And then there's a Government Accountability Office report that showed that a lot of this, because the enhancements incentivized insurance companies and brokers to have as many people on, receiving these as possible, that there's some fraud, at least a lot of fraud risk that they found, and some confirmed instances of fraud. We also reported on that at the Center Square. So essentially, all this is to say that Republicans, except for a few who wanted to kind of make a compromise, these rank and file ones, Republican leaders, at least in the large majority, did not want to extend these. And so a vote on those failed in the Senate last week. House Speaker Mike Johnson did not allow Democrats to bring a similar extension vote, 3-year extension of these in the House. So they're going to revert to pre-pandemic levels, which will partially contribute to millions of Americans' premiums rising in 2026. And Congress has just left, and it doesn't really seem like they have a plan, given that the only one on the table, Republicans, is likely not going to pass the Senate. So that's where we're at right now.
Looking at your reporting this week, Therese, extending the Obamacare enhanced tax credits would cost an estimated $350 billion over 10 years, while the Republicans' bill would reduce the federal deficit by about $35 billion by 2035. That's according to the nonpartisan Congressional Budget Office. That's essentially the reason why Republicans did not want to extend the Obamacare enhanced tax credits, because of its overall cost. Is that correct?
Yes, partially. And it is worth noting that Democrats have essentially, at this point, they had given up on a 10-year extension, and they said, okay, just 3 years. But that, even just 3 years, is $83 billion added to the deficit. But yes, the cost was definitely a big factor for a lot of Republicans. But another thing was, as I mentioned, the fraud that, or at least the very, very, very high risks of fraud, the lack of guardrails, the ability for the basically fake enrollees at the Government Accountability Office tested in the program to just receive the subsidies and receive insurance without providing any documentation that was requested. That 18 of the 20 that the GAO submitted, these fake applicants because they were testing to see how much fraud was in there, 18 of the 20 as of September are still receiving health insurance, subsidized health insurance, and roughly $10,000, equaling up to about $10,000 a month. So that was kind of the bombshell report that a lot of Republicans grabbed onto, saying, see, look, this is why we haven't been, agreeing to an extension, for Democrats, because they're supercharged with fraud and they cost a lot. And there was also, there are definitely some Republicans who are concerned about the fact that the credits can be applied to plans that cover abortions. So it's, kind of indirect application that a lot of them are concerned about. So there again, so it's, as you can see, it's something that would be very difficult for Republicans to swallow. And a lot of them just don't want to and have decided not to. And so now you have the American people, a lot of them are wondering, what am I going to do next year? It is also worth noting on, as you were saying with the cost, that, these enhanced premium tax credits are current law, right? Or current policy, I should say. So they're currently still, happening, but they're going to expire. And under the logic that Republicans used for their one big beautiful bill, that means that extending tax credits that are still in place shouldn't cost anything. That's the reasoning that they used to extend the large bulk of the tax credits in the 2017 Tax Cuts and Jobs Act. So it is interesting to see that, and lawmakers on all sides do this, as we all know, is that they'll kind of change their arguments when it's something that they don't want. So that's also very interesting, is that, okay, they're correct that, according to the Congressional Budget Office and other people, that yes, a 3-year extension of the enhanced Obamacare tax credits would cost $83 billion over the next 3 years. But that kind of calculation, that kind of accounting, that traditional accounting that's been used, is something that a lot of Republicans kind of just did away with this past June and July in order to make other tax credits permanent that they did like. So as you can see, it is a very thorny issue, not just because healthcare is always a thorny issue and it's something that a lot of people are dissatisfied with in the U.S., but just because this particular issue, these credits in particular are just, there are so many things that different people can find issue with. So that's, again, since the beginning of the shutdown, the focus has been on these enhanced premium tax credits. So that's kind of been where we're at the moment.
Therese, thank you for joining us today. Listeners can keep up with this story and more at thecentersquare.com.